what are things beyond medication and even psychotherapy that can help with mental health? Because I think there's a lot people can do in their day to day to improve their mental health. And yes, if you need it, it can be very helpful to see a psychiatrist, psychologist, therapist, what have you. But I think things like, I think a big one is physical exercise. I think there's a lot of evidence that's coming out in terms of the benefits of physical exercise for mental health, but not just mental health, but other physical health, sleep. There's a lot of evidence coming out in terms of how physical exercise can potentially be preventive in terms of cognitive decline as you get older, preventing dementia. Alzheimer's are the types of dementia. So I think talking about those sorts of things, behavioral interventions, the role of diet, obviously the role of substance use. I mean, something we talk about a lot, but um, I think there's not enough that we can say about it. And I think this ties back to my message of, I really like to help patients feel empowered in some way. I think it's important to convey to them that even if there's a lot going on in your world that you can't control, there still are certain things within your locus of control that you can do. So again, looking at your day to day, what can you do in terms of getting exercise? What can you change about your diet? What can you change about your sleeping habits, et cetera, et cetera. So helping people know that these are things that you can do and should do that will help you out. And that goes hand in hand with any other treatment you're doing, whether that be psychotherapy or medication. So I think really emphasizing those behavioral interventions, those day-to-day habits in promoting mental health. And again, the exercise one, I think is a big one. And I think there's going to be a lot more evidence that comes out these next few years in terms of the role of that.